alterations of renal and urinary function. This is a diagram similar to the figure on page 725 in your textbook. And again, this is the nephron, which is the functional unit of the kidney. It's on a figure on page 725 and 729. This is kind of combined both of them. And this, again, is the components of the nephron. It's taken a bigger picture and broken it out, and it shows the pictures of your distal convoluted tubule, the proximal, all the pieces of a nephron. And again, these are in your textbook on pages 725 and 728. And this is the important piece, the fact of where what substances are secreted and reabsorbed and where that occurs. And this diagram is also in your textbook on page 731. All of this is normal. And when you're talking about the kidney, you have to think about what the kidney normally does. We know it filters the blood and eliminates waste. That's all we usually think about when we do that. But it also is very important in blood pressure regulation. The juxtaglomerular apparatus, the JG apparatus, is in the distal convoluted tubule. That synthesizes, stores, and releases renin when necessary. Renin converts to angiotensin 1 to angiotensin 2, and then angiotensin 2, because the renin converts angiotensin 1 to angiotensin 2 in the lungs, and then angiotensin 2 causes the release of aldosterone from the adrenal glands. And aldosterone saves sodium, and along with sodium goes water. Now our ANP, which is your atrial natriuretic peptide, which is produced by the atria of the heart, will inhibit the release of renin. Some of the wastes that are secreted are your uric acid, your urea, your creatinine, your bilirubin. Now, your creatinine is your end product of protein metabolism. Ammonium chloride and any drug metabolite will be secreted. Okay. The kidney is also very important in erythrocyte production, and this is because it produces and releases the hormone erythropoietin. That hormone is active for 24 hours, and it goes to the bone marrow to increase red blood cell production. And erythropoietin is released anytime you have a low red blood cell count or when you have low oxygen levels. So if you have somebody who lives at the top of Pikes Peak all the time, their hemoglobin content will be higher than somebody who lives here in nice flat Ohio, because they're used to living in an area that doesn't have 21% oxygen as your base amount. The kidneys are really important for activating vitamin D. If you don't have active vitamin D, you cannot absorb calcium from the gut. So you need active vitamin D. If you don't have it, you're going to have problems with your skeletal function. You're going to have osteoporosis. It produces prostaglandins in the kidney, and in this area it is a very potent vasodilator. Most places where prostaglandins is produced is a result of the inflammatory process, and it causes pain. It does not cause pain here. Urodilantine is also produced by the distal tubule, and that decreases sodium and water reabsorption and increases urinary output. Your acid-base balance is adjusted because your hydrogen ions are excreted, and your chloride and bicarb are saved when necessary. It maintains your fluid balance. Keep in mind that an infant is 77% water. Females are 50% water. Men are about 60% water because they have less body fat than we do. The elderly are only 50% water. And it maintains your electrolyte balance by excreting and or reabsorbing your electrolytes. Now, you also need to know your normal renal function tests. Those are on page 737, and your bladder function tests are on page 738. So those are two tables that you need to look at. And this is looking at your renin-angiotensin-aldosterone system, and you're looking at the distal tubules. They're not really up on a thing. They pulled them up out of the nephron so you can see them. The adrenal gland and your JG apparatus, and how this occurs. Urinary tract obstructions. So now we're going to talk about the abnormal. We've talked about the normal. Now we're talking about the abnormal. Urinary tract obstruction, whether or not it causes a problem, depends upon where it's located. Is it in the ureter? If so, it's going to cause hydroureter or hydronephrosis. That means that urine will collect within the renal collecting system and will cause a retrograde increase in your hydrostatic pressure. It could be complete or partial. Now, acute complete obstruction results in renal failure because your GFR drops to 0, your glomerular filtration rate drops to 0. If the obstruction is relieved within a week, the symptoms resolve. If not, they go into acute renal failure. Chronic partial obstruction leads to damage to the renal tubules and an increased risk of dehydration and metabolic acidosis because urine compresses the kidney structures, causing damage to the renal tubules. It prevents the kidney from saving sodium and water, resulting in high urine volume with a low GFR, glomerular filtration rate, that causes dehydration and acidosis because they're excreting hydrogen ions. Whether it's bilateral or unilateral. If it's unilateral, you may not even realize it because the other kidney is continuing to produce urine. And what is the cause? Is it a tumor, a stone, edema, pregnancy, a benign prostatic hyperplasia, a decrease in bladder muscle function, inflammation, or stricture? When you relieve that obstruction, it will result in post-obstructive diuresis. In other words, you're going to have large quantities of urine because your glomerular filtration rate will return to normal. If the GFR does not return to normal, there may not be significant diuresis. Complications from obstruction are infection, and that occurs more so if the obstruction is below the bladder, or renal failure. And this is if the obstruction lasts more than a week or if it is bilateral. This is showing different sites of possible obstructions and possible causes. A polycystic kidney can cause hydronephrosis. You've got dysplasia. You've got problems with the valves. These are all different possible causes of obstructions and their sites. So the types of obstructive urinary disorders could be kidney stones, also called renal calculi or nephrolithiasis. Stones will cause about 20% of the obstructions. Could be a neurogenic bladder, could be a stricture, tumor, either in the kidney or the bladder, or it could be a polycystic kidney. Go back to the previous slide and look at the picture again. Now, kidney stones are formed around a nidus, and a nidus is a crystal that forms in the presence of certain substances, and those substances might be calcium, which occurs because of prolonged immobilization. Keep somebody in bed 24 hours, you start to lose calcium from the bone. You start to lose your muscle mass, so you need to get people out of bed as soon as possible. Could occur because of an alkaline urine. because it's calcium 2 precipitate can cause stones. Calcium stones are the smallest, most common form. Tends to occur more so in middle-aged men. Struvite stones are made of magnesium, ammonium, and phosphate. They occur more in alkaline urine, more so in women, particularly after UTI with either Klebsiella, Pseudomonas, or Proteus organisms. Uric acid is due to gout, somebody who's on a high purine or protein diet, so occurs more often with acid urine and concentrated urine, so somebody who's not drinking enough fluid. And cystine stones are more so in acid urine, and they're very, very rare. Now, these stones, when they form, might form a staghorn calculi, because these are really, really, really big stones that grow into the pelvis of the kidney and look absolutely horrible and have to be surgically removed in most cases. Symptoms for your kidney stones are pain, flank pain that radiates to the groin or the costovertebral angle. This pain is so severe it will require narcotics to relieve the pain. It's a colicky pain that's rhythmic in nature. Because there's peristalsis, it helps to move that fluid from the kidney to the bladder and on out. And so it's oftentimes called a renal colic. You'll have hematuria, nausea, and vomiting. And as you realized, I had mentioned that most stones occur in alkaline urine. So you want to keep your urine a little bit more acidified, and that's why cranberry juice helps. A lot of cranberry juice. This is different spots where you might see the kidney stones. Got a staghorn in the kidney, that's the bottom one there. You've got some right at the exit and some in the exit into the bladder and out of it. Very painful, very painful. I'm told that it's more painful than having a baby. I've not had either, so I really can't tell you for a fact. But I do know I took care of a gentleman who had a kidney stone, and every word that came out of his mouth was 4 letters long, and none of them were care, love, like. They were words that, as a very naive, brand new nurse, I hadn't heard anywhere. And so I just gave him some IV morphine and told him if he needed something to give me a call, because I wasn't going to stand there and listen to that. When I went back in 20 minutes, half an hour later, to see if the medication had helped, it had, and he apologized for his language and told me, he was a minister and he didn't use that language most of the time. So that was kind of interesting. A neurogenic bladder is a functional obstruction due to the interruption of the nerve supply from the central nervous system or the spinal cord. An upper motor neuron lesion means that it's occurring below the cortex but above the sacral level of the spinal cord. This will result in loss of voluntary control of urination, and this is usually due to multiple sclerosis or spinal cord transection or a tumor of the spinal cord. It's also called detrusor hyperreflexia. A lower motor neuron lesion occurs, that means it's at the sacral level of the spinal cord, will result in loss of both voluntary and involuntary urinary control. This is due to trauma, tumors, herniated disc, polio, or diabetes. This is called detrusor areflexia. So you will have enuresis, which is bedwetting, The bladder doesn't empty completely. You'll have loss of sensation of your bladder fullness. There's a table on page 744 that lists the types of incontinence and neurogenic bladder information. So you need to look at those. You may have a urethral stricture. This is narrowing of the lumen of the urethra, and this tends to occur more so in men. It can be due to infection, injury, surgical manipulation, but the severity depends upon the location, the length, and the degree of the blockage. Prostate enlargement is due to inflammation or benign prostatic hyperplasia or cancer. Pelvic organ prolapse, such as a cystocele or low bladder wall compliance, with the cystocele, you have your bladder prolapses into the vagina. This will cause urgency and signs and symptoms of an overactive bladder. So you'll go frequently, very small amounts. A low bladder wall compliance means that you have the bladder cannot stretch and accommodate the urine. So you end up with a hydroureter, hydronephrosis, and impaired renal function. Renal tumors are classified by cell type and the extent of the metastasis. Benign is uncommon, and it's encapsulated and tends to be an adenoma. Malignant is an adenocarcinoma, and it's the most common form. Tends to occur more so in men between 50 and 60, those who are cigarette smokers, obese, or black. It's usually unilateral, and it spreads through the lymph nodes and the blood vessels. Symptoms, the early stage, there aren't any. But as it progresses, you get hematuria, flank pain, a palpable mass, and weight loss. And when the weight loss occurs, the disease is very well advanced. You'll find the staging on page 747 with a picture on page 746 about renal tumors. I have a friend who was in his late 50s, early 60s, when he was complaining of some back pain. And so the physician ordered an ultrasound of the abdomen just to make sure that there was nothing going on there. And they found a kidney cancer, a renal tumor. It was unilateral, and it was stage 1. And it was just by chance that they found it. He's the luckiest man alive. He's doing really, really well. Bladder tumors, those at risk, more so men around 60, or people working in chemical, rubber, or textile industry. This will metastasize to the lymph nodes, the liver, the bone, and the lungs. Initially, again, they're asymptomatic, or they may have hematuria that is a lot of it and painless. That's not normal. If it's advanced carcinoma, you'll have frequent urination and pelvic pain, urgency, nocturia, and symptoms similar to those of a UTI. You should never ignore the symptoms of a UTI. Nephroblastoma is Wilms tumor. This is an embryonal tumor of the kidney. It's the most common solid tumor in children, even though it's still fairly rare. It's associated with parental exposure to hydrocarbons and heavy metals. It is autosomal dominant inheritance or sporadic in origin. So it's either genetic or it's not. You'll have vague abdominal pain, hematuria, fever, an enlarged asymptomatic abdominal mass, and hypertension. Tends to occur between the ages of 2 and 3. It's slightly higher in blacks. tends to be encapsulated. So it's fairly easily, it's kidney, nephro. Blast means they're immature cells. So it's made up of, that's why it's an embryonal tumor of the kidney. So basically they're at birth and then not discovered until they're 2 or 3. Polycystic kidney disease is the most common autosomal dominant disease of the kidney system. It develops fluid-filled cysts in both kidneys. Symptoms are hypertension, chronic renal failure, cardiovascular problems, mitral valve prolapse. They'll develop cerebral aneurysms, cysts in their liver, their pancreas, their spleen. They'll have diverticulum in the colon. They'll have pain and hematuria. And they will develop end-stage renal disease by the age of 40. This is not a good thing. And this will finish part 1